Ladies and gentlemen, Joe Davin with Healthcare Solutions Team, Healthcare Made Simple. This is the first video I'm doing on Medicare. My focus over the years has been on the under 65 market, but I've been doing Medicare for the last 3-4 years. I will tell you one thing about Medicare. The government would like you to think it's much more complicated than it actually is. Once you get the hang of it, and I know just about all the crazy rules and regulations there is to know about Medicare, it really is so much more simple than it would seem. Especially when you're turning 65, you start, in the 3, 4, 5 months before your date of birth, you receive 1,000 pieces of mail. You're getting phone calls. You're getting publications from the insurance companies. You're seeing the commercials. It's never ending. But this video is going to focus on AEP, or Annual Enrollment Period. Now, this is the time where there's several different changes that could be made to your current Medicare setup. Okay, so I'm going to go through what can be changed. You can always reach out to me. I'm happy to look at all the options. I'm a non-captive agent in Medicare, just like under 65, so I'm able to look at everything in the market and sign you up for whatever is best for you. And year over year, things might change slightly in the plans you're in, and that would lead you to potentially make a change for something the following year that would be better for you. Okay, so number one, let's talk about the people that are on original Medicare. So you got Medicare Part A and Part B. Most of you, if you're on original Medicare, you probably have some type of Medicare supplement and probably a prescription drug plan. So number one, for all of these, you can make no changes. Okay, when you're on original Medicare, year over year, your supplement, the cost might change as you age. The rates tend to go up quite a bit. Okay, but if you're okay with that, you can always stay the same. One thing you can do if you're on original Medicare with supplement is you could change to Medicare, what we call Part C, which is also known as Medicare Advantage. Okay, now I'm not going to get into the debate, at least in this video, of Medicare Advantage versus Medicare Supplement. I know it's the raging debate, but what I'll tell you is whatever you've probably heard about either is wrong, because I talk to people every day where they say that their neighbor told them this, their sister told them that, and it's just so far off from the truth. Medicare Advantage, Medicare Supplement, whatever you're on, whatever's best for you, it might not be best for your twin sister. It's very much based on you as the individual. So one thing you could do is look at Medicare Advantage, okay, if you're in a Medicare Supplement. And the advantage of doing that is most Medicare Advantage plans are zero premium. So if you're paying $150, $200, $300, $350 as you age for a Medicare Supplement, that could go down to zero for certain Medicare Advantage plans. Okay. Now, Medicare Advantage plans, they come with their own risks. There's some costs and copays and coinsurance. We'll talk about all that. It may be for you, it may not be. Another thing you can do is you can join a standalone prescription drug plan. Okay. If you don't have drug coverage, now's the time you can do that. And drug plans change year over year. You get a document called the Annual Notice of Change. It'll tell you certain medications that might change tiers in your drug plan. It'll tell you if certain meds are no longer covered. You're going to want to know that. And you can reach out to me because, any good agent has software where we can plug in your prescriptions and tell you what's the best drug plan going to be for the following year. Okay. You can also drop Part D. You can drop your prescription drug coverage anytime during annual enrollment period, which again is October 15th to December 7th. Now, if you drop it and then you pick it up later, there could be penalties for not having continuous drug coverage. Now, if you're on a Medicare Advantage plan, you could switch to another Part C plan. Just like I told you with the drug coverage, you get an annual notice of change for your Medicare Advantage plan. So the network could change, okay? The coverage could change, the copays could change per day for doctor or for hospital. These are things you're going to want to know, and you're always going to want to compare and take a look at the market and see if there's another company with a better deal. Okay, Aetna, Humana, Blue Cross, United Healthcare, some of these big carriers that in certain states, Humana might be the best option one year, United or Aetna might be the better option the following year. The good thing is, in Medicare Advantage, it's become a lot more competitive. Okay, so the coverage seems to be getting better over time. So you always want to take a look. You can also, if you're on Medicare Advantage, at this time you can go back to original Medicare. So you can go back to Medicare Part A and B, and then you can look at adding a supplement and prescription drug plan again. Caveat there, when you are outside of your open enrollment period, which is the 3 months before and after you turn 65, or if you held off on Part B because let's say you were working when you turned 65, if you are outside of the, I think it's 8 months after you drop your employer coverage and get on Part B, that's your open enrollment period. During this time, you can get on any Medicare supplement plan with no underwriting. After that, if you go back to Medicare Part A and B and you want to add a supplement or you want to change from Medicare Advantage to Medicare Supplement, there might be some underwriting. So if you have some health issues, companies may not take you, they can rate you up. Just something to keep in mind. Okay, and you can also add prescription drug coverage if you switch back to original Medicare. Remember one thing, a lot of Medicare Advantage plans, they also come with prescription drug coverage, okay? Now, just want to focus on the prescription stuff, and I kind of addressed some of this. I talked about the annual notice of change. It's always in your best interest, as I stated, to shop the prescription drug plans, okay? Especially if some people will, when they're younger, they're not taking a lot of meds, they'll sign up for the cheapest plan available in their market, maybe paying $6-7 a month. Oftentimes Aetna has plans in certain markets that are around that price. Now you got sick and now you got a bunch of different meds that you're taking. That certainly might not be the best plan for you anymore. We're going to want to plug those medications in again and see if there's a better option for you, okay? And the rates could change depending. Or, like you said, Medicare Advantage plans, they come with prescription drug coverage. So the drug coverage on the Advantage plan could change also. So that's something we want to look at. And I kind of addressed that here. So reach out to me. Medicare, again, it is very simple. I'll be completely honest with you throughout the process. You can reach me on my cell at 708-566-6589, and we'll kind of take it from there. Or just feel free to shoot me a message. But thank you. Happy AEP. I expect to hear from you soon.